So, Dr. Blackmore, welcome to Rotary and welcome to right now 102, and it keeps crawling every time I look, so it's increasing. So, welcome to Rotary, and can you tell us what we need to know?
I hope so. I'm glad to join you, and I'm Dr. Carina Blackmore. I'm the state epidemiologist in Florida. I need to look at the camera rather than at your picture. Speaking just a few minutes today on COVID, and I think that the situation in Florida has changed probably since this meeting was set up a week or two ago. And as you know, our numbers have increased quite substantially here in the last week. We are definitely seeing some community-wide spread, especially among the younger population, although we were reminded today that when we do look at our numbers, the increase is there among all age groups, but not as dramatic in the older age group, which of course is what we are concerned about because of the more likely severe complications and the potential risk for fatalities that we see among older and people with underlying health issues in our state. So the COVID virus pandemic, in some ways, it's fairly straightforward because it's a respiratory virus, and it behaves kind of like influenza in that you get infected when you're close by someone sneezing and coughing on somebody. And there really is not a lot more that we can do right now besides distance ourselves and keeping good hand hygiene to protect ourselves, because we do not have a vaccine. The medical science is improving every day, so we are starting to see some treatment options and improved methodologies that hopefully will improve our survival for those that end up in the hospital. But there really isn't a magic bullet, unfortunately, for preventing COVID infection. So certainly, and the other thing with COVID is that not everyone who is infectious, meaning can transmit the virus, is symptomatic. We do know that people can transmit the virus up to 2 days before they become symptomatic, and then we do know that there are people who never, or at least are not aware of them, that they have symptoms, and they transmit the virus as well, because the symptoms can be quite mild. Some people only develop a mild cough or a transient fever. There are people who the only thing that they know that they've experienced is a lack of sense of smell or taste as the only symptom that they are aware that they had. So I think that many of us miss this, and then are not aware that that we may be then contagious and transmitting COVID, and so then put others at risk sort of inadvertently. So again, the key is, as I know you've heard, that we have to stay social distant from one another at 6 feet or more, wear a mask when we're in public, and don't share objects, and make sure that maintain good hand hygiene. So when it comes to the culture that Rotary has, and I am familiar with Rotary. My father-in-law was a member of Rotary and active for many years, and I'm of course very familiar with the polio eradication project and other efforts that Rotary are involved in that are public health related, and so very appreciative of the organization. But the issue is that it is going to be very important, as our numbers are rising, to take it very seriously. To, if you do have face-to-face meetings, try to keep those socially distant. If you do share meals, perhaps try to do some sort of meals where you either bring your own food or where it's not a buffet type situation where the utensils are shared among participants. Those types of basic premises, I think, are very important. Trying to, of course, in Florida at this time of year, it's challenging to be outdoors, but outdoor settings where there is a better air circulation is better than the indoor setting. And certainly this virtual environment that you seem very proficient at meeting this way is, of course, the very best way of meeting. And making sure that if you do have symptoms of COVID, of course, not to attend meetings, face-to-face meetings. If you are contact of COVID patients, that if you're close contact, you really should be quarantined for 14 days to make sure that you don't spread virus to others. And clearly, anyone who is infected with COVID or know that you have COVID, suspect that you have COVID because you're symptomatic, or someone who is a close contact of someone who has COVID, very important that they should never attend a face-to-face gathering where you can potentially transmit COVID. The risk, of course, is not random. The close contact that we're talking about is of some duration. The CDC is talking about 15 minutes. I think that's a little high, but it is not passing someone in a hallway or just sort of the random contact. It is a deliberate conversation for minutes at a time where you really think the risk really increases in those close types of settings. But again, especially for people with heart disease, kidney disease, diabetes, people with obesity or a BMI that is greater than 30. Lately, we've added sickle cell anemia to that list. People with severe immunocompromised conditions, people who are on cancer treatment, for example, folks older than 65, and anyone with a respiratory disease. Those are all known groups of people who are more at risk for severe effects of COVID illness, and definitely we want to all protect those, making sure that everyone is either does not get COVID or at all, or can stay out of the hospital getting infections that are not as severe as we know they can be in some groups. So again, nothing magic, sadly enough. It is the social distancing, the hygiene, the face mask. That's all coming down to that. Those are the key tools that we have, and we will not have them anything else to our disposal for months, possibly more than that, depending on when a vaccine becomes available. And there are some discussions about that maybe being at the end of the year, but I would suspect that we will not have something that everyone will have access to that quickly. So those basic premises is what we have to work with.
Okay, thank you very much. Catherine, do you have any questions that you're seeing on chat that are?
No, actually, just that with the real possibility of asymptomatic transmittal responsible for a substantial number of infections, how can we be, it says maybe consciously meet, perhaps is what it's supposed to say. And then there's also, so that just a couple of questions. Now there are a number of them coming now.
Well, so if the asymptomatic, is there a way to tell anything about an asymptomatic person, whether you are that person or whether you are the person at the door welcoming people?
No, I think we're learning more about who is at most risk as an asymptomatic person of spreading the virus. We certainly know that, like I said, many then develop some sort of symptoms that within the 2 days prior to becoming symptomatic, that's absolutely a time. But then again, I think that some of the symptoms may be so mild, so we miss them. Those of us who are busy and healthy and you know, may have allergies and other things. We had poor air here this weekend in the Tallahassee area because of the Sahara dust and confusing perhaps COVID symptoms with other. So I think that the best strategy is to really limit the number of people that we come in contact with within 6 feet. So really try to stay 6 feet from anyone except for just passing them in the grocery store or so forth, and then also wearing the face mask. I think that is the best way of avoiding infection at this point until we learn more about who is more at risk when you're an asymptomatic shedder than others.
Okay, Catherine?
There have been a couple of questions about, are buffets okay if the servers wear masks and gloves, but I'm gathering from what you said it's better to do individual plates, period.
It definitely is, because if the server with the gloves, you know, touch their face or and so forth with the gloves on, they're not that effective anymore. And then the thing is, so servers, I mean, servers with masks and servers with gloves, if you're really adhering to those strict policies and not have any of the guests get in contact with the utensils, is better than having the guests using the utensils. But I think the plates situation is probably the very best.
And then probably the last one, should we wear masks or not wear masks at Rotary events where multiple people are together?
So there is some limited evidence that masks may be helpful. It helps protecting people from you. I mean, it does not protect the person who wears the mask, but it protects people around them if you happen to be that one asymptomatic shedder. So I think that right now is a good idea to wear the mask. But it's also important that the masks are clean and not you know, that you change masks every day. The other thing I was going to say is that the other way of preventing you know, you from spreading the virus is to not attend large events, because we have absolutely seen that when we get people in a bar or a restaurant where people do not social distance, we've had outbreaks associated with large weddings. When we don't follow the less than 50 people at a gathering, ideally less than 10 if you're in close contact, those absolutely have been associated with the rapid rise in our case count. So you can absolutely help your community and your friends by every day being careful with what you do and the groups and communities that you associate with.
So I've got one final question for you. If we have the criteria appears to have changed. At one point it was 10. I'm not certain if it's now 50. Where can we find those limits and what the other, whether they're legislative or whether they're most likely an executive order from the governor or from our mayor even? Is there a central place where we can find those things?
So the executive orders from the governor can be found on the Department of Health website under news. All the executive orders from the governor are there, and the gathering size of 50 is part of that executive order, except for, so the gathering size of 10 was when we were in phase 1 statewide. The gathering size of 50 is for the phase 2 that we're in most everywhere across the state. Then there are some local ordinances where the local government have imposed some additional guidance to that, and those would be available at the county or city level. There is, for example, not a statewide mask ordinance, but there are some communities in Florida that have local ordinances, Leon County one in Tallahassee, that requires people to wear masks when they're out in the public setting. So both, but most of it, we are really, I think, at a time where we all have to use common sense and sort of do our part. And it's not the magic number. The risk is gradual. The more people that are in a crowd, the greater the risk. The closer people are, the greater the risk. So it's just trying to limit as much as possible, spread out as much as possible. And physical barriers is another thing that potentially could be used in places to minimize the risk. You see them now in many of our stores. You see them at our medical offices or dental offices to try to limit spread.
Okay, well, thank you very much, Dr. Blackmore. We all know, we've seen the statistics, we know you are deep into this, and you making time for us today when it was so different when we originally talked. I really appreciate you taking the time, appreciate your staff, their support as we discuss this. So our great appreciation to you for everything you're doing, for the long sleepless nights. And I think I speak for the whole group. I'm just saying we greatly appreciate your expertise.
Thank you so much. And we're all in this together. And it is definitely a community event. The one in charge is the virus. And we're learning more about the virus every day, and hope to, obviously, as we learn more, fine-tune guidance and fine-tune recommendations. But we are, I appreciate the opportunity, and thanks again for all you do through Rotary.
Thank you again.
Bye-bye.
Okay, I will mention the next folks we're going to talk to, and let me just mention one thing. I saw a number of things on the chat about questions that we haven't answered. So if you do want to put your name on that survey link, it was at the beginning of the chat there. Jeff put it on there. So take a look, click on that link, put your name in there. We will look for some of those answers for you. I saw one on liability. We'll work with a couple of insurance folks and find out what we can about that. Many of these questions don't have answers yet. So our next speaker comes from our District 6970 from the Fleming Island Club, Starr Keating. Could you tell us a little bit about what you all did for a fundraising event that did not involve what we're used to, which is a big in-person event? Now, here's the deal. This is a joint brainstorming session. If you are on this call and you have had a virtual fundraising event, please put your information in the chat. Type it in there or whatever, but share what you did. If you can share how much you netted out of this, if you can share your learnings in there, that would be greatly appreciated. Starr's information will be tossed in right here as we start off, and she will tell us what she did. And then Mary, do we have, let me just double check with our folks. Jeff, do we have Mary identified yet?
Yes, she's unmuted.
Okay, great. So Starr, if you
Yes. Can you guys
Start
hear
up.
me?
Yep, hear you fine.
Okay, so early on in COVID, right earlier to the middle of it, we were alarmed with the lack of food at the food pantry, and we're all trying to think, what could we do? And literally within less than 2 weeks' time, the board came up with a virtual wine tasting. Our goal was to have 40 participants. We had 90. They were $40 a person, and it was 3 different kinds of wine. A winery in Riverside helped support this. And they got delivered to your door the day of, and we really encouraged people to make cheese platters, and it was so much fun. So we all interacted, and he had us taste each wine, told us where it was from, what it pairs well with, and he donated sales of those wines back to our cause as well. So people could order a case of wine once they tasted. He also donated a wine tasting that we auctioned off. So we raised the $4,640 before expenses, and we were able to give a check, within a week to the food pantry. It was incredible.
Okay, and how long, just a couple of things you mentioned to me, you figured out you needed to do this with how much advance notice?
Less than 2 weeks.
Less than 2 weeks.
So
Okay.
someone had a contact with the wine person. He was everybody was going stir crazy, and he was excited to help us. And so a couple people were live there with him so we could Zoom it, and all over Jacksonville. And the challenge for us became, we had so many participants that it was delivering the wine, but thankfully nobody was working. And so we had 5 or 6 different volunteers from Rotary take an area, and we went from Fleming Island to Queens Harbor to St. Augustine, and people were just so excited to be doing it.
Okay, great. So had fun at the same time you raised funds.
Absolutely.
Sounds good. Okay, Mary, if you do have questions for Starr or Mary, please put those in the chat, and if we don't get them answered today, we will ask them if they could help us answer those. So Mary, could you speak up and tell us what you had at Alpharetta?
Yes, hello. Thank you for having me. So Alpharetta Rotary on March 15th, when we all sort of went into quarantine, was planning a coming out party for our new district governor at our district conference, which was going to be on Derby weekend. Of course, that got canceled by the end of March. So on April 1st, we had a first phone call to say, hey, how do we recognize this gentleman from our club who's becoming the district governor, which was our original intent. And he said, I don't want recognition. Right now, we need to have passion, service, and impact in our communities. Of course, as a club, we still wanted to recognize him, but we wanted to take his charge to have passion, service, and impact. And so we said, let's continue our theme of having a Derby party, because it was on Derby Day. And there's 20 horses in the Kentucky Derby. So let's pick 20 organizations from our community representing the 20 horses in the Derby. Each one of them will be assigned a lane in the Derby. And each members of our club were assigned to be jockeys for that organization. So the jockeys really came together to drive the donations and to share information about the impact that we would have on this organization if we gave. So that involved 20 people from our club right there. Those people all went out to their friends in Rotary, in their churches, in the community, in their businesses, and said, hey, I'm jockeying this cause, and it's the ABC homeless shelter, or it's the food bank, or it's the coffee house that services people with disabilities, or it's, whatever it was. And they asked them to donate. So we had an online donation site that was powered through Classy, CLASSY, and you have to purchase that. And so it was a month later that we had the Derby, and we raised $110,000. Now, the key learnings on that for us were these. First of all, that fundraising isn't about one person in the club doing fundraising or 5 people. It was about involving our whole club. It was about asking our whole club to ask others to support the organization that they were passionate about. And it was about telling the story of each organization. So each jockey not only had to ask their friends, but they had to tell the story of what the organization was doing and what impact they were having during COVID. So what we found was that in the past, a lot of our fundraisers have raised money from people inside the club, but about 70% of our donors and 70% of our funds raised came from outside the club. People that maybe one person or two people in the club knew, but most people in the club did not know, nor did they really know us, nor did they really know Rotary. So it served a number of purposes. We made our incoming DG the Grand Marshal, so that honored him. We raised a bunch of money. We exposed a bunch of new people to Rotary. We got a closer relationship with a lot of our organizations that we were donating to, and they got more exposure with us. So on the day of the Derby, of course, the Derby wasn't run, so we couldn't show that either. But we randomly picked an old Kentucky Derby, and we showed that. So after we all sang My Old Kentucky Home, which is what they sing right before that, and this was all done on Zoom, we sang that. Before the Derby ran, we had people in our club send in pictures of their bourbon bars, and we had a bourbon bar contest. We had pictures of people in our club and people from the organization send in pictures of themselves in derby hats or seersucker suits or whatever. And we had a Kentucky Derby Best Dressed contest. And each person who won any of those contests won extra money for the organization of their choice. So instead of having a plaque or a trophy or whatever, or a gift certificate to that person, they won more money given to that. So it was really, really impactful in our community. It was done in 1 month. And I think the clubs that can really think of new ways to do it and can sort of pivot on that, pivot and have a new way to do it, are going to be the ones that really succeed. We need to do business in a new way. This was definitely business done in a new way. And it was super fun. Our club loved it.
Well, Mary, thank you. I noticed that we are now out of time. We're very respectful of people's time. Is it okay if I get back to you with some of the questions that people have on our chat, and for you and Starr to give us some more information on that? And we'll include that with all the people. Jeff, if you could put that survey link on one more time on the bottom, that would be very helpful. We'll leave that there for folks. And then Mary, I'll get back with you, and Starr, I'll get back with you. And probably within the next 2 to 3 days, as soon as I become past district governor and no one cares who I am anymore, I'll be able to put all that together and get that out to folks on July 2nd. Sound good?
Mike, the only other thing that came up that I committed to is that we will provide a recording of this on the district webpage in our YouTube channel of this meeting.
Sounds good. And I'll also have a link to our recording here in Zoom. So Catherine, anything else we need to cover?
No, there were a number of questions, but some of them were pretty specific, and I think hopefully were covered by Dr. Blackmore, and then some of the two clubs that presented fundraisers, I think, addressed those questions more or less. Thank you.
Okay, good enough. Well, thank you for everyone for coming on. I appreciate your interest. I appreciate the difficult situation that we're all in. And we will see you in, I don't know, a month or something like that if we have another issue like this that pops up. If you do have ideas about this, I will be working in both 6970 and 6940. If you find issues like this that you think we ought to deal with, my email address is Mike H, as in Henry, Dara, @gmail.com, and you can let me know, but I'll be sending that email out to you so you'll get that then. So thank you all, and have a good and safe next 6 months.
Thank you.